It took a volcanic eruption for Baron Karl Dreis to come up with the idea of bicycles replacing horses. In our most difficult times, we as a human race are our most creative self. And to me, now is no different. My name is Manu Prakash. I teach at Stanford, a design philosophy I like to call frugal science. In this talk, with the background of the worst pandemic of our times, I want to talk about creativity, curiosity, invention, and collaboration as the primary tools we need to use to fight this crisis. As scientists, we have been battling this pandemic, and in some ways, we are losing the fight. But in others, we are actually winning. My own personal COVID story begins when I was returning from early March from France, and I found myself first in a hospital and then in a strict quarantine in this very room right here. And in a moment of inspiration, I wrote a few series of openly accessible Google documents just describing what I as a scientist felt that we need to be doing, because I felt we were completely ill-prepared. Now, these ideas, to some, might have sounded whimsical. They ranged from a completely new way of manufacturing N95 masks, some of the most critical tools required for healthcare workers, made out of cotton candy machines that we could buy off of Amazon. It talked about a completely new home diagnostic solution that was inspired by using a glow stick. I wrote down a way of thinking about how to use recreational snorkel masks into PPEs that could be used in an ICU. And finally, we discussed ideas around how to build full-featured ICU ventilators at a low cost, primarily using automotive parts. And within a period of 2 to 3 weeks, we were able to build teams around each one of these ideas with academics, students, industrialists, manufacturing partners, and most importantly, clinicians at the table and ready to fight. At the heart of each one of these ideas lies a simple vision of frugal science, a goal to build scalable, distributed, and cost-effective solutions all the way from diagnostics to prevention to treatment of COVID-19. Ensuring that these solutions are actually accessible to all people. It's very important for us in these troubling times to be grounded in science. We rigorously tested every one of these ideas and measured every possible assumption to be able to build the most robust sets of products to the market. Starting with an example of pufferfish, our open source full-featured ICU ventilator, we partnered with manufacturers from India, Kenya, Nepal to be able to rapidly build and design a full-featured ventilator that can be manufactured locally. If we succeed, this would be the very first ventilator that is full-featured that has been manufactured on the continent of Africa. On the context of snorkeling masks, we partnered with medical device companies like Boston Scientific and manufacturing partners like BIC that are well known for making large-scale ballpoint pens to be able to roll out a global solution in 22 countries for snorkeling mask-based PPEs with a deployment of literally 25 or so thousand of them just in France alone. In the context of diagnostics, our work started with a quick phone call with an NGO in Bolivia requesting us to be thinking about COVID tests that don't require any electricity because COVID was starting to spread in rural regions, especially in the Amazon. And what we invented is a new way of thinking about a home test that doesn't require any electricity, that is literally inspired by a children's hand-powered flashlight and these glow sticks. Ironically, we later on realized that these tests are not just needed in faraway places, but are needed right here in every home in the world. And we're partnering with organizations to be able to bring this lamp-based diagnostic test, a home test, to your home. On the context of N95 manufacturing, we literally bought the 5 most available cotton candy machines to first demonstrate that we can make N95 grade filtration material, and moved on to partner with a large-scale manufacturer that is now enabling a little factory, a mask-making manufacturing factory that would fit in this room and could hence fit in any back room in a hospital, ready to manufacture N95 grade masks in a moment's notice in a distributed manner. Many of us as academics got together to initiate and start an NGO called N95 Decon, which has been on the front lines to bringing both the resources and the information to clinicians who do not have the time and resources to be able to gather through all the changing literature on decontamination standards to bring clear guidelines to decontaminate safely some of the most precious resources of our pandemic. I look back at the last 6 months. They've been the most exhilarating time of my scientific life, but also the most bothersome. I've reflected upon this time, and I feel there are deep lessons that we have to learn. Of course, I'm not the first one to say how broken our healthcare systems are, not just in faraway places, not just in some faraway developing country, but literally for the people who don't have the resources. The difference we have seen on options that are available for haves and have-nots, independent of where they live. We have also thought about new ways of building and designing open reference designs for all critical care medical equipment to truly be able to enable large-scale manufacturing of critical medical components around the world in a distributed manner so that it's not dependent on supply chains. I've also felt a new energy in the scientific community to truly engage with industrial partners, and not in a transitionary manner, but to truly build partnerships that are around solving problems. And I don't have to remind everybody that we have a lot of problems, all the way from climate change to the diseases like malaria and TB, and many of the challenges that we will face because of the pandemic with the disruptions that happen in healthcare delivery. I do believe we will defeat this pandemic, but we will come out after this pandemic with a bicycle. And my bicycle is the context of frugal science shared globally.